Hi, this is Dr. BALA'S. It's nice to see that many of you are interested in knowing about this disease, diabetes. Well, it's nice because when you hear the views of many people, definitely you will try to know more and more, and you will try to know where you stand as far as diabetes is concerned. Definitely, I feel you will get some clarification that there are many things which we have to consider. What all I say is my own view, my own approach with my own patients. The confidence with which I talk is because of the success I had with many patients and the, the smiling face of many patients when they leave us. That will motivate us. And I feel whatever I know and whatever I have learned and whatever I have applied with my patients, it should not just stop in a small circle. So I just want to share all my views and opinions about this disease as well as some of the patients I met. In my last video, I told that many people are exploiting the ignorance of our diabetic patients. And I told it's not a killer disease. And this video is to substantiate my views and why I say it's not a killer disease and how you can save from this simple disorder. The very first thing I would like to emphasize is never and ever get compromised. Health is not a compromising factor. That too, when you can attain and maintain a normalcy, why don't you try for that? I know it's not just with you alone, it's a teamwork, a team of your doctor, yourself, and also your family members. This is not a single man's problem. When one man is affected, the whole family is affected. The whole family has to adjust according to his own habits, food. So it is not just treating one person, it is equal to treating a family. So that is how the approach should be. So never get compromised on your values, the sugar values. My sugar was 500 when I came to this doctor. Now it is 200. That's a great doctor. 300 milligram you have reduced. I'm so happy, doctor. If the doctor says, yeah, that's good, maintain that. No. Both of you are not correct. You should not get satisfied with this value. The doctor should not encourage that view also. The doctor should say, no. We have ways to bring it back to normal. So we will try that. That's a good approach of a doctor. And a patient should ask, doctor, normal value is around 100, I heard. Is it possible to bring back to that 100? So what I mean to say is, don't get compromised. 75% my sugar is reduced values. So I'm happy. No, not like that. What you are doing is you are not treating you. You are not preventing complications. You are just postponing complications. Even after 10 years, you are you only, and you are going to suffer. So plan everything with a vision, a long-term target. That is how the approach should be there. My point is, you should never suffer at all if it can be prevented. And I told it can be prevented, so why should you suffer? A good doctor will not accept these values till he achieves this target of normal value. I'll tell you a small example. One of my patients is not very old, he was around 35 to 40. He came to me and he was so much depressed. Okay, at least 50% will be okay for me. To that person, I asked a question. Is it okay if your kidneys are spoiled after 5 years or after 10 years. Which will you prefer? Suddenly, as a reflex, he told, after 10 years, doctor, see where we are. I never expected this from that boy because it's not a matter of time. Even after 10 years, this boy is going to have a problem. At that time, he will think I should not have compromised that day. The person, the boy, should have told me, doctor, my kidneys should not get spoiled at all. If there is a possibility, can we try for that? This type of approach must be there with the patient as well as with the doctor. So you are not coming to us for postponing things. You are coming to us to prevent things if it is possible. Now, let me tell you why I said it is not a killer disease. The first thing is doubt. Do I have a diabetes? Really? How to know this? Simple. A blood test. Many people ask, how can I get? The results may be wrong. The lab is not good. I will counter check it. I'll go for a second lab and some other lab. It's natural to have a second opinion and another test to confirm your values. If you are getting a normal value in one lab and a bit higher value in another lab, you will say the normal value lab is a good lab because that is what your expectation. But to me, both are right values only. Nothing is wrong. So it just shows that your pancreas is struggling to control. At one day, your food, your activities, and finally the amount of insulin secreted, if everything is proportionate, you take less food, more activity, the quantity of insulin is sufficient at that time, at that day for that activity, definitely you will get a normal value. The next day being a Sunday, you take a lot of food and you have in between snacks and you don't do any activity on that day. If you take that day, it will be a bit more. So in that case, what does that mean? Very simple logic. Suppose you have a servant maid and she is going to resign. The person may be irregular. Her work may not be perfect. So what does that mean? That means that person is going to resign from the job. The same thing here, pancreas. One day giving a normal value, the other day giving a lower value or a higher value, whatever it may be. Varying values means the pancreas is struggling to maintain, to bring to normal level. It's not able to secrete adequate insulin for every meal, every day. Like a servant maid, it means it is going to fail. A servant is going to resign and this is going to fail. This is what the meaning of getting one day normal value and one day higher value. Even I can say this is a stage of pre-diabetic stage. It is the right time you should diagnose at this time so that when the pancreas is struggling, you can give it less work and with a little insulin, you can prolong the life of your pancreatic cells which secrete the insulin. You can prevent from becoming a full-fledged diabetic. So when you get one day wrong value, one day high value, one day low value, that's the right time you go and check and follow your status. So now the doubt whether I have a diabetic or not is cleared. So first clear that doubt. If you really want to know actually, no, I want to get it confirmed right now, whether I have it or not, you have something called the glucose tolerance test about which we will talk later. So there are a lot of tests to confirm whether you are having diabetes or you are going to have diabetes. Even you can measure your insulin level. There are a lot of ways to confirm that. The next point, why I said it is not a killer disease. The first thing is diagnosis. You can diagnose a diabetic by the test what I mentioned earlier. Easily. Availability of diagnostic tests at affordable cost. Not like this corona and all. When the corona started, we didn't have much place to test whether we have corona or not. It's not like that. It's a simple test, affordable price. From the results, Even you can predict whether you are going to get it or not. That is also possible. It is easily understandable. It's all mere numbers. What is your number? What is a normal number? You get the normal value by the side of your own value. Compare that and come to know that you are having it or not. It is not like ECG, X-ray, scan, echocardiogram. Not like that. Only a doctor can interpret. But this, you can interpret the values. After all, mere numbers. It is easy to diagnose your testing. So there is no confusion. If you know the value, which is a bit more than normal, from the values, you can even see the improvement of treatment. When you start treatment, either lifestyle changes or tablets, before treatment and after treatment, what is the value? Now, when the value comes down, that will motivate you. So, we are taking the right medicine. The medicine is working. My value is going down. I am very happy. You will feel like continuing the treatment and you will have the confidence in the treatment. Not only in the medicines, you have the confidence on the doctor also. So I am with a good doctor. Not only the value becomes normal, even your symptoms they start disappearing. The dryness of mouth, thirsty, loss of weight, tiredness, increased appetite, all these symptoms slowly will disappear. So again, another proof that the drugs are working and the doctor has prescribed the right drug. So diagnosis is easy and monitoring is easy because all depends on the numbers only. But the problem is, even though the treatment is working, you have to monitor this periodically. This is where our mind gets upset. How frequently I should go for a blood test? Every time. So you have to periodically know and to monitor to know whether it is controlled because the organ which is at fault, the pancreas, belongs to you. When you age, the organ also is getting aged. It is already a failing organ. So as you age, the pancreas is also getting aged. The quantity of insulin, which was low at the time of diagnosis, is going to be lower as time goes on. So that you cannot predict. So you cannot say that you are prescribed a drug 2 years back and I am continuing the same drug, doctor. I always follow your advice. That's not correct. The drug which worked 2 years back, you cannot expect the same drug will work even after that because of the age factor. So at that time, you have to manipulate the treatment. You have to alter. You have to increase the tablet. So this is one thing which is really making people go away from this type of treatment. They are upset. If you consider pancreas as a factory, and there are 100 people are working in a factory, suddenly 50 people stop working. What will happen? The remaining 50 people have to work. So 100 people work, 50 people have to do. One person have to do, two people work. So that is an extra work. So slowly, in that 50 people, another 10 people may resign. So again 40 people. Like that, the number of cells which are working will be going on failing. So when it is failing, the sugar value will go up. At that time, you have to change the treatment. That is why we need a continuous monitoring. Yes, I know. It's a lot of disturbing to do blood tests often. But if you overcome this stage, you can prevent a lot of complications. The next point is medicines. We have a lot of medicines for this. 20 years or 25 years back, we have only very few drugs. We didn't have any other option. We have to manipulate or increase the dosage of these one or two drugs. Now we have a lot of drugs with a lot of mechanisms. and lot of changes in our approach also. Changing a diet, a little bit of exercise, and a good combination of drugs will do wonders in a short time, not years, just in months, 1 month, 2 months. Do not get panic about the number. Oh, 500, 600. Don't worry. It's all mere numbers. Don't judge a person by his appearance and size. Try to just touch that person and push him. He will fall down. Like that, only this number. The number may look very big. Immediately they'll start. Insulin, no need. Why? Try tablets, try oral drugs. See the result. You may have a lot of insulin, but your body may not be using it properly. Try that way. Start with that. Definitely. So if the number is a big one, doesn't mean that it's a big problem. Not at all. But one thing you have to remember, the disease is one, but the approach and the result will differ from person to person because the response for the drug differs from person to person. Every diabetic is a different diabetic. That means what? A drug which is working wonderful for one person may not work for you. So you cannot ask, give the same drug to me. It's not like that. The drug may be same, the disease may be same, but two people are not same. For him, that drug works like that. For you, how it will work, what response I can get from this drug, it's only a trial. We give it and see the result. Because it is not only drug, the food pattern, the dietary habits, and the activities, everything is different from other person. So for your diet pattern, for your activity or nature of work, whether this drug will work or not, we have to do a trial. It may or it may not. We will modify that according to your situation and your habits, etc. So everything is individualized. For some, lifestyle modification, for some, tablets, for some, injections, for some, it's a combination of one or two things. Next is the drugs. I told you a lot of drugs are available. Affordable price. It's not very costly. There are a lot of drugs which are less priced actually. And many people are worried about the side effects, immediate or long-term side effects. No, nothing to worry about that. All the drugs have been tested, did lot of trials on this drug. Only after coming to know that the drug has got not much of side effects or threatening side effects, then only the drug will be released. If the drug causes some problem, definitely they will ban the drug. This is one big question. People are confused. They'll ask me, imagine if you don't take the drug, what will happen? You are 100% sure of getting a problem. If you take the drug, the possibility is very much reduced, which is preferable. One thing is definite, you're going to get a problem. Another thing is not definite, which is better. Take drug with a confidence. Don't get carried away by these rumors, and don't take any medicine with this fear. If you think that these drugs will have side effect, the one which you are taking will not have any effect at all. What will you do? When we are monitoring you, the whole world is monitoring the drugs you are taking. It's not so easy. And you are not the only person who is taking this drug. Throughout the world, crores of people are taking. We doctors always compare the effects and defects, the benefits and risks. Then only we prescribe. And one more thing I'll tell you. As I told in my previous videos, there are many doctors who are diabetics. Many family members of the doctors who are diabetic. All those people are taking the same drug. If they cause problem side effect, you think that we will take or will prescribe to our own family members? Definitely not. Why do you worry? When you come for one problem, diabetes, do you think that we will produce another problem by giving a wrong drug or a drug which has got side effect? Don't you think it is unethical? We won't do it. Believe us, belief is life. The next point is expense. This is also an imagination. People have created a scene in the sense that diabetes is a big problem. So the drugs will be very costly. Not only that, there's another feeling among people that only costly medicines will work. I don't know who infused this ideas and thinking into your mind. Not at all. The medicine aspirin is a very less priced medicine. It prevents heart attack. So finally what happens, there are many people who asked me, when I choose a less priced drug, the question they ask is, doctor, will they work? Because it's a very cheap drug. I don't understand what is the meaning of cheap. So this is how you make us to prescribe costly drugs. Now tell me, who is at fault? Not the doctor. You. You think only costly medicine will work, and instead of explaining all these things to you, we are forced to write costly medicines. And you will say diabetes is a costly disease. Not at all. Not at all. Take the medicines, see the result, and then believe. Both. Believe the medicine and believe the doctor. So not much to spend. If you have a good doctor and if you cooperate with less expense, you will get more benefit. We eat from birth. Have we ever asked, should I eat lifelong? We have never asked such questions. If you like to have a long life, take a lifelong treatment, a simple treatment. Accept it. Can't you take 1 or 2 tablets to live? So that's about the expense part of this diabetes. So you need not spend much thinking that costly medicines will. Next thing is this disease is treatable. It is treatable in the sense it doesn't kill you, not like an attack. Even we have medicines for cancer, HIV, but you have proven drugs and treatable disease. So believe and believe that this disease is a treatable disease and even preventable also. If you know that you are going to get it, take some modifications in life and you can avoid the disease also. There are many diseases like this which you cannot cure, only to control. For example, an increased blood pressure, hypertension. That's also a lifelong problem. You're going to take tablet. If you stop the tablet, the BP will shoot up. So you have to take the tablet. Only difference between that and this is the blood test. That is why you are worried. The next point is it does not spread to others. It is a non-communicable disease, non-infectious disease. That means there is no isolation, no quarantine, no fear of transmitting this disease to others. But the problem is you get depressed once you know that you have diabetes. The depression will increase your diabetic status. And that is one reason you lose interest in taking treatment. Finally, you get into problems. Once I happened to see a small kid, 1 or 2 years old kid. You know the blood sugar value for that kid, it was 600 milligram. There's no family history for that child. Father, mother, everybody hale and healthy. Imagine the situation of that father and mother. Every day they are giving insulin for this small kid. If the child cries for some time, the child may go for low sugar. So 24 hours, the parents have to look after this child. Imagine a situation like that when compared to your child. So think like that. Life is only a comparison. When somebody is suffering more, your sufferings will be less. Compare yourself. If you smile and take the tablets, the effect will be more. The next point, complications, organ failure. This is what you are worried about. Yes, then why the organ fails, doctor? This is what your question. If everything is okay, it is treatable, less price medicines are available, easily diagnosis, you can monitor prognosis. With all these things, why the organs fail? Remember, it is not like accidents. Just like that it happens. It is not like an attack, a heart attack or a stroke, just like that. An organ fails only after 5 to 10 years of mismanagement, not in 1 month or 2 months or 1 year. If you don't properly take treatment, at least for 5 years or 10 years, you will not get a problem. All these problems are preventable only. So if you fail to take the advice of a doctor, if you fail to continue the tablets, if you fail to monitor your blood sugar, organs will fail. Now just tell me, who fails? The organ does not fail. It is not a renal failure. It is your failure. It is our failure. That is why I say, understand the disease, understand the doctor, understand yourself. Then only we can achieve the goal. Because this organ failure, as I told you, 5 to 10 years. You may ask why it is 5 to 10 years. It is not how long you are a diabetic, how much diabetic is a matter. A person who has got only a moderate elevation of blood sugar, the complications will be delayed. The organ failure will be very much delayed. If your sugar value is high, then the time taken for the organs to fail will be less. That's why I say it is not the duration that decides the organ failure. It is how much you are diabetic, how severe your diabetes is, that will decide how earlier you will get problem. So I have told the facts why it is not a killer disease. Easily diagnosable, easily monitored, the progress is very much seen, the symptoms are relieved, you have wonderful drugs, number of drugs, a combination of drugs will work wonder, will do wonder, and also it is treatable and it doesn't spread to others. With all these positive points, do you think that diabetes will kill you? If diabetes causes problem, it means you are not controlling diabetes. The diabetes is controlling you. That is why you get problem. It is 100% not a killer disease. And one more point I'll tell you, with with a good doctor, with a good cooperative patient, if the doctor gives a good combination of drugs, how much of live insulin secreting cells are there in the pancreas? So this is how we approach and we make many people happy. Follow this. You will also be happy. In my next video, I will tell you the importance of this carbohydrate. Carbohydrate and sugar and glucose, they are not poisons, they are not toxins. It's a food. The body needs this food. Any dietitian or nutritionist will say 60% of carbohydrate should be given. It's an immediate source of energy. They see carbohydrate as an enemy. It's not like that. So in my next video, I'll tell what is the importance of carbohydrate. One. Second thing, what is the normal value of your blood glucose or blood sugar? We will discuss in that in my next video. Till then, relax. Don't worry. Have confidence. Believe that you will be all right if you are diabetic. Check your blood. If you see a mild variation, see that it does not progress to a full-fledged diabetic by your change in lifestyle. You see, try to live. You will not get diabetes. Even if it is there, you will not die of diabetes. 100% assured. In the next video, in which I'll explain the normal value of sugar, why it should be maintained at that level. Thank you.